Hello everyone. Welcome to Culture and Tradition. Today, we have an important topic to share with you. A Cigna spokeswoman said the insurer uses prior authorization for popular drugs like Mounjaro to make sure patients get the medicine they need. As for Christopher Marks, he said, "We're disappointed and we're sorry and saddened by the fact that this happened." Christopher Marks saw immediate improvement when his doctor prescribed Mounjaro for type 2 diabetes last year. The 40-year-old truck driver from Kansas City, Missouri, said his average blood sugar levels have dropped and he plans to use less insulin than before. But when his doctor followed the doctor's orders and increased the amount of Mounjaro, a drug that sells for more than $1,000 a month, Marks' insurance company, Health, refused to pay. Marks has a Cigna policy that he purchased from the federal health insurance marketplace, healthcare.gov. After 2 complaints in a month and a half, Cigna agreed to cover the higher percentage. A few months later, she said, when it was time to increase the amount, she was denied again. In November, it was decided that it was no longer valid with Cigna, because the insurance company stopped operating in Missouri earlier this year. He decided to stay on the sidelines until the new system came into effect. "It's very interesting. People shouldn't be like, it's not worth fighting to get my medicine," Marks said. The process Marks experienced is called prior authorization or sometimes access. Insurance companies say they use and prevention to lower costs and protect patients from unnecessary or ineffective treatments, but the practice has drawn opposition from patients like Marks and groups representing doctors and hospitals, who say early approval could interfere with the Biden administration announced new laws in January to improve the system for patients with certain health plans after congressional failures, including a bill that passed Congress in 2022. However, states are considering first authorization, which is ongoing. Last year, lawmakers in 29 states and Washington, D.C. considered nearly 90 bills aimed at limiting pre-authorization, according to the American Medical Association, with the biggest wins in New Jersey and Washington, D.C. The Medical Association expects more and more costs this year. The rules written in the written rules of the organization. In 2018, health insurance companies signed an agreement with several hospitals and health organizations that expanded the ability to improve the authorization process first. But the lack of progress since then shows the need for legislation, said Jack Resnick Jr., former AMA president and current representative. Resnick, a California dermatologist, published bills pending in Indiana, Massachusetts, North Carolina, Oklahoma, and Wyoming that include many of the policies that the AMA supports, including emergency response times, directive policies, and insurance has already been provided for notification and public programs for mitigation. A claim amount that is sometimes called a golden card. Legislation has come from both Democratic and Republican lawmakers, and some are partisan, like in Colorado. In Missouri, the law of the Republican State Representative Melanie Stinnett aims to establish one of those gold carding programs for treatment and prescriptions. Stinnett said she regularly was frustrated by prior authorization hurdles in her work as a speech pathologist before joining the legislature in 2023. "The stories all kind of look similar. It's a big fight to get something done on the insurance side for approval," Stinnett said. Then sometimes, even after all of that fight, it feels like it may have not been worthwhile because some people then have a change at the beginning of the year with their insurance. Under her bill, a medical provider's prior authorization requests during a 6-month evaluation period would be reviewed. After that period, providers whose requests were approved at least 90% of the time would be exempt from having to submit requests for the next 6 months. Exemptions also apply to institutions that meet the threshold. After that, he said that they should follow this plan to make a luxury style. 5 states, namely Louisiana, Michigan, Texas, Vermont, and West Virginia, have implemented various gold carding programs. The American Medical Association, AMA, is currently monitoring the progress of gold carding bills in 13 states, including Missouri. According to a 2022 survey conducted by AHIP, an industry trade group for health insurance plans, slightly over half of the surveyed plans utilized a gold carding program for medical services, while approximately 1/5 employed it for prescriptions. The feedback received was mixed, with 23% stating that patient safety either improved or remained the same, and 20% expressing concerns about increased costs without a corresponding improvement in quality. Well, that's the end of our topic of the day. We hope that you found this information enjoyable. Please remember to like, comment, subscribe, and share the video. Don't forget to activate the notification bell. Take care.